Welcome to Nursing School Explained. Today's video targets the CPR guidelines or some important tidbits that you need to know and you might have forgotten about during your last CPR course or from your refresher. So this by no means is a CPR course in general, but it is a refresher about the main points that it takes to keep a patient alive until first responders arrive and can take over the scene. And these guidelines are based on the 2020 American Heart Association guidelines. So remember, when the patient is unresponsive, you go ahead and you check a pulse. And when you determine that there is no pulse, then you start CPR. And that pulse check is very important. There are two sites that we are referring to as central pulses, and they are the carotid or the femoral pulse. Most likely you're going to check the carotid pulse, so make sure that you know how to check these specific pulse sites first. Now, when it comes to the pulse check, we want to make sure that we check it for 5 seconds. So you need to be very in control or knowing where this anatomic location is or are, but no more than 10 seconds. So within 10 seconds, you need to be able to determine, does this patient have a pulse or no? Because time is muscle. So the sooner you start CPR to a non-pumping heart or not efficiently pumping heart, the better the outcome for the patient will be. That's why we have this 10-second max window here. And then the next guideline is push hard and fast. So first of all, hard always refers to the depth of the compression, and that is about 2 inches or 5 centimeters. So that is quite a bit of the compression of the patient's sternum, but think about it. The patient's rib cage and sternum are covering the heart, so it takes some certain depth to get through to the heart to actually massage it and produce the pumping effect of that heart muscle. And then when it comes to rate, the rate is said to be 100 to 120 times or compressions per minute. And some people like to think of it as a song. So staying alive sometimes helps. Ha, 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 staying alive, staying alive, staying alive. That is a pretty good rhythm to keep the patient alive, and it kind of works with the theme of the scene. Now next, we want to make sure we allow complete chest recoil. So when we compress the patient's chest, we want to make sure that we don't just let go of it halfway, because during that recoil, the heart gets filled with blood and the coronary arteries that supply blood flow to the heart actually get filled, and then they produce the cardiac output and the perfusion to the cardiac muscle. So that is very important. Minimizing interruptions. So don't try to fuss around. We also have, again, this 10-second time rule here. So we want to minimize any interruptions that we are on the patient's chest performing compressions, because time, again, is muscle. Which brings us to the next point, meaning saying change compressors every 2 minutes or sooner as needed. So 2 minutes should be a few cycles of CPR. And after 2 minutes, if you're doing CPR right, you are going to break in a sweat. And in order to give the patient the best possible outcome, we need to make sure that we minimize the interruptions and that the compressor is not fatigued and can actually provide the correct depth, rate, as well as allow for that recoil. Now, most likely, if you're the first responder, the first person there, you're going to have either a face shield or a mouth guard or a BVM if you're maybe a little bit more equipped than the usual person. And so if there's no advanced airway, is basically what we're saying. The ratio of CPR compressions to ventilations is 30 to 2. So 30 compressions, 2 ventilations. 30 compressions, 2 ventilations. Until either the AED arrives, which we should get that AED as soon as we can. So once you recognize that the patient is unresponsive, it doesn't have a pulse, then you should be calling for that AED. And the AED, we need to get that on the patient's chest as soon as possible and follow the directions. The AED is a foolproof tool. It will tell you exactly what to do and when to do it and if you're doing it right. Now, the AED is so important because not every patient who doesn't have a pulse doesn't have isn't asystole, so flatline. So there are certain shockable rhythms that you'll learn about in school later that can be treated with the shock, and it's very important to get that AED there as soon as possible. Now don't get confused, don't fumble for the AED and get that set up as soon as you can while omitting CPR. CPR is still the most important, but then while you're doing CPR, you're keeping the blood of the patient flowing until the AED arrives. Now, once the AED gives you directions, it'll tell you resume CPR, stop CPR, check the patient, whatever it is. And you keep repeating that cycle until EMS or first responders arrive and they direct you otherwise, or they take over the patient care. So remember, these are only quick instructions and tidbits about how to do CPR. Make sure that your CPR certification is up to date and that you also know how to be proficient in performing this very important skill to keep your patient alive. Please also check out the other videos I have about pediatric and infant CPR, those same little tidbits that you might have forgot about since your last class. Thanks for watching Nursing School Explained. See you soon.